Welcome to Rare on Air, the monthly podcast from Eurordis, Rare Diseases Europe. I am your host, Julien Poulain, and once a month, we will be exploring the challenges, experiences, and successes of people who live with a rare condition. Last week, on the 20th of November 2024, we marked the 100-day countdown to Rare Disease Day 2025, which will take place on the 28th of February next year. In honour of this milestone, today's episode of Rare on Air ventures beyond Europe as I speak with Kelly du Plessis, Chief Executive of Rare Diseases South Africa and the mother of a teenage son living with Pompe disease. Kelly's journey into advocacy began when her son was diagnosed with this rare genetic condition at 11 months old. 15 years ago, she faced major barriers to accessing a life-saving treatment for her son, but through unwavering determination and ceaseless persistence, she successfully secured the vital therapy that her son needed. Kelly's story is a powerful one. It is a story of resilience and the relentless drive of a mother whose child is facing the gravest of dangers. In our conversation, Kelly goes on to outline to me the unique challenges of advocating for rare disease patients in South Africa today, a country grappling with healthcare disparities and competing priorities. And against these challenges, Kelly shares with me her vision for achieving meaningful progress for South Africans impacted by rare diseases. So, Kelly, thank you very much for joining me today.
Thank you so much for having me, Julien.
I'd like to begin first and foremost talking about your son's diagnostic journey and the first onset of his Pompe disease and what the journey was like after that point to him receiving a diagnosis. I understand he was diagnosed in 2010, but can you share with me details of that journey from the first onset of his symptoms to receiving that diagnosis? Was it a difficult journey?
Absolutely, it was. So I think firstly, important to note, I was a young mom, first-time mom as well. And realistically, you have no idea what you're doing, particularly as a young mom. So I didn't have many friends who had children at that point. We were the first group to have kids. So there wasn't very much reference points, but I kind of always got the perception that something wasn't 100% right from the time that he was an infant, really. And then he started with the reoccurring chest infections and generalized failure to thrive. So things like reaching for your bottle and, crawling and sitting unsupported just kind of never really progressed. And if he could start something, he generally went backwards after a while and it didn't continue as you would have expected. So from about 6 months old, I really started getting very worried and, was quite concerned as to what was going on. And I just had this nagging feeling that something wasn't 100% right. We were quite lucky that we got a diagnosis when he was 11 months old. I think that in a country such as South Africa, where awareness was so low, but diagnostic ability was relatively low then as well, we can be quite grateful that that diagnosis came through when it did and that we managed to actually get a diagnosis in time. Jean was 11 months old when that diagnosis came through, and I'm pleased to report that he's a typical 15-year-old boy now, living his best life.
Well, that's brilliant to hear. If I may ask, what exactly is Pompe disease and how would you explain it to someone who may not have heard of the condition?
So back then, my understanding was less than zero. Pompe to me was a volcano.
Yeah.
That's what I knew it to be. And it was also a song. It was very popular by a band called Bastille. So that's all I knew. But essentially, it is an enzyme deficiency that results in an accumulation of glycogen in all forms of muscle, so smooth and skeletal muscle. So that's really everything from your cardiac system to your diaphragm to your large muscle groupings like quadriceps and hamstrings. And because his body has an inability to produce this enzyme, he goes on to result in an accumulation of glycogen, which is a complex sugar, and that forms a toxic buildup within the systems, within the lysosomes. And essentially those lysosomes will expand to the point that they burst open, and all that toxic fluid then runs into the surrounding muscle, causing catastrophic damage. So while the lysosomes are still formed before they've burst open, the body's still not able to extrapolate the necessary glucose that is required for the muscles to function optimally. So not only do they have a lack of sustenance from a sugar perspective, you also have the risk of once they've burst open, you've got that toxicity. Essentially, children and young babies have this cardiac manifestation, which results in an enlarged heart. That's one of the first things that gets picked up on X-ray. They often will have recurrent chest infections because the diaphragmatic muscles are so thin and unable to actually produce a proper cough, etc. So those chest infections set in and they just sit. You will often find that they're not able to reach their motor milestones, sucking, swallowing, sitting, walking, crawling. Those things take a long time to happen, if at all. And it's quite catastrophic. The median age of death for infantile Pompe disease is 8.7 months.
Wow. So that just highlights how fortunate your family was to have received a diagnosis when that period of time, I guess, would have been, breached, really, no?
Yeah, we were very, very lucky. We were so lucky that we were able to get intervention as quickly as we did.
Yeah, that does actually bring me on to my next question. I understand you were able to get the treatment for your son. What exactly was the treatment, and how and why were you able to succeed in getting that treatment for your son so soon after his diagnosis, despite what I understand to have been a lack of accessibility for the treatment in South Africa?
I think I get like PTSD when I think back to the trauma. But at the time that they gave us the diagnosis, the doctor was quite frank. And he said, look, there is a treatment available. It's available overseas, not here. Chances are you're not going to get it. Go home and really enjoy his first birthday, because chances are unlikely he'll have another one. And that was the conversation.
Oh, wow.
And I was a little bit of a millennial in some respects, I think, quite, a young mom, quite entitled, mid-20s, think you know everything. I just couldn't quite grasp why anyone was telling me that there was something available, and I just couldn't have it because I lived in South Africa. And so really within the first 24 hours, I spent researching all the different access avenues and understanding what our regulatory system looked like. And the product wasn't registered, so you had to apply for special concessions to be able to utilize an unregistered medication. And they told me that would take weeks. And I just called the regulatory company and I was like, look, I don't have weeks, so you don't have weeks. Like collectively, there's no weeks. So you just need to do what you got to do. What is it that you need? Why is this process complicated? Managed to get all the documentation, etc., that they required and submitted everything. And then we got that approval within a few days. And then it was the mammoth task of dealing with our insurance company around the cost of the drug and them reimbursing. And they said no. And I was just like, well, what do you mean no? They said it's too expensive and there's no benefit for that. And I was like, well, that's just not good enough. My child's going to die. And I landed up just going into like super mom, fierce protector mode, where I refused point blank to take no for an answer. I fought with everyone right up until the top of the food chain at the pharmaceutical company, as well as the insurance company. And I just refused to take no for an answer. And after days and days of absolutely like just not taking no for an answer, they agreed. But then I was told the drug's actually physically not in the country. And now there's that whole process to get it here. And I was like, I really don't care if someone has to get on a plane, put it on their lap and fly it to themselves. This child is expected to be in hospital next week, Wednesday. I don't care who's got to do what, but that drug best be here by the time that he goes into hospital. And it was a case of the stars aligning. I think people realizing that I wasn't going anywhere and I was just going to be a, monumental pain in the bum, so to speak. And from that, we managed to get him treatment. So he started his treatment 10 days later. But from that, we then had to go through even further discussions. And I had to take our medical insurance to our regulator through the court process to get them to provide us with a long-term authorization, because every opportunity they got to stop paying or decline something, they wouldn't. And this treatment is lifelong and it requires consistent therapy. So I think they thought that the problem was going to go away after one or two treatments and didn't quite understand that this was going to be a lifelong expectation. And so I made it very clear that we were not prepared to take anything less. And well, here he is. Yeah, still. He's been on treatment now 14 years and doing well.
Wow, that's incredible. I remember reading into your story and seeing that 10-day time period and being quite amazed by it, but I had no clue about what actually you had done behind the scenes to actually arrive there. That sounds like quite a heroic journey. Congratulations would be the wrong way of putting it, but well done for having done that. That's really incredible. I guess it is quite disheartening that the delivery of that treatment to your son wasn't the result of the regulatory system or compassionate interests on behalf of all the different actors involved. It sounds like it was just your determination and insistence that you were not going away and that this treatment needed to be delivered.
Yes. At one point, when our insurance company had declined us, their office building was next to one of the biggest radio media production companies in the country. And I actually went and I sat there and from 8:30 in the morning. And I said to the lady, I said, you've got until your company closes today to give me this authorization. And if it's not there, my next stop is next door. So you've got two options. You can either find a way to make it work or not. And well, that was one such day where all of a sudden someone came from the, ivory towers up above with our authorization and said, here it is. And sometimes that's what this world takes. It takes a sheer determination. Like everyone is going to say no. It is cheaper to say no. It is easier to say no. It's our jobs to get them to change their minds.
Absolutely. Yeah, I was suspecting there might be some sort of mention of media exposure because that's sadly what it takes in these instances to make companies or other organizations do the right thing. If I may ask, going back to when he first started receiving his treatment, did it have an immediate impact on his health and the way that the condition could be managed? What impact essentially did the enzyme replacement treatment have?
It's an interesting question. I mean, I can remember what he smelled like, what he was wearing, and I can remember watching those first drops drip down the drip bag like it was yesterday and thinking to myself, will he feel this almost immediately? And I can say that he almost seemed to have a lot more energy right from the beginning, but the hard work came in actually activating those muscle groups and getting them working because they had essentially been lazy all their life. And that required years and years of continuous daily therapy, trying to activate those muscles and supporting him. So certainly from an energy perspective, and also I think from a general health perspective, he wasn't getting the continuous infections, etc., immediately afterwards and as sick as often. So there was definitively some immediate benefit. But then the hard work came in, right, we've got him on the treatment. Now we've got to focus on getting everything else right to ensure that we give him the absolute best chance. And for me as his mom, the one thing that I kept telling myself in the back of my head was, I need to get this child walking before he understands that he shouldn't be able to. Because the minute that he knows that it's a barrier for him, it'll end up being an excuse.
I see.
And that was just my thing. And I was just like, I'm going to push him and push him and push him. And it was the hardest thing I've had to do as his mom. Taking him back, kicking and screaming every single day to physio and saying, we're going to keep trying and it's going to be sore and it hurts and like it's frustrating, but we just got to keep going. And this was my little 1-year-old boy who I was putting through this grueling physical therapy process every single day.
Yeah.
But we got him walking. And from that, we've never looked back. I was pregnant at the time with my daughter. And obviously we were dealing with knowing that she had a 25% risk of having the same condition and having to deal with that emotional components as well. But yeah, we got through it. And my one thing to parents in those beginning days is you got to do everything that you can before they understand the immensity of the problem. And it was so touching because I spoke to my son a couple of weeks back. We've just had a new Pompe child diagnosed. He's been symptomatic now for over a year, but he's young. He's only 2. And my son said to me, he said, Mom, I need you to make sure that that child knows not to listen to what the doctors say because they will give him a limit and he's capable of more. And it was just such a profound moment for me to hear him say that because he too has had to push past what everyone's expectations were. And if he had not allowed himself to do that, he might be wheelchair dependent and non-ambulatory because that was where it was going.
What do you think is the motive or the reasoning behind why that might be a doctor's approach?
I don't think it's as much the approach as it is managing the expectations. Doctors will always err on the side of caution. And even if you've got a blood result that virtually confirms, it'll never say it's 100% confirmed. It'll always say 99.9% because medicine is that way. They always have to allow themselves open to interpretation. So I think they have been trained as clinicians to err on the side of caution and manage expectations and rather under-promise and over-deliver than the other way around. It was my job as his mom to make him believe that he could do more. There's that saying that as a mother, you have to love your kids enough. It's like pouring water into a bucket, that all the holes that the world puts into that bucket can't drain the liquid quick enough. I just had to make him believe that he was capable and he could.
Yeah, no, I see. Do you remember the moment you were first inspired to establish a broader community? What were your steps to turning a vision such as creating a broader community into reality?
it kind of just grew organically. But for me, in speaking to other families that were going through similar things, I knew that I had managed to navigate the system and kind of wanted to share that knowledge. And it was quite cathartic to be able to give back in a way that almost turned your pain into purpose, because otherwise I think I would have battled to understand why we had been put in this position emotionally and spiritually. You grapple with that, and to reconcile, like, why us? So being able to give back to those families really helped. And it wasn't just Pompe, it was other disease areas. People started approaching me for assistance and realizing that I had the ability to help them and guide them. And we did some PR, some press in my efforts to try find other patients like Jean and other Pompe patients. And wow, a whole host of patients just like approached us out of nowhere. And there were so many that were just in dire straits. And so I was like, okay, we're going to start a support group. And before I knew it, it had turned into the advocacy group that Rare Diseases South Africa is today.
That sounds like quite also a common story of how these communities end up being established. And what was the moment exactly when it went from the formation of a Pompe community to the formation of a rare diseases community?
I think it was almost inception.
Really? So there wasn't really like a sort of staggered approach. It was really kind of combined, because you probably saw that there were the same challenges and problems being faced by people with a rare disease that wasn't Pompe.
Correct. It took us a good, I would say, 2 years before we had actually found the next new diagnosis of Pompe.
Right.
But we obviously found a lot of other rare diseases along the way. And interestingly, one of the first fundraisers we did was something called Pedaling for Pompe. And it was a cycle race that happens here. It's actually happening this weekend again.
Oh, cool.
We put together this team, and our friends got people who not could ride a bike well, but who were comfortable on a bike enough to sit on it for 100 Ks. And a couple of years down the line, an adult patient called me and said to me, I've just been diagnosed with this condition and my doctor says that there's no hope. And in telling my family, my cousin declared that he had ridden for your cycle team years ago and that you could possibly help me.
Oh, wow.
We went on to assist that patient. He started treatment within a couple of weeks. He's also doing really, really well. I remember that as clear as day, because when he sat his family down to give them this news that he'd been diagnosed with this terrible condition and there was very little that could be done, his cousin went, no, but hold on a second. I'm pretty sure that I cycled for a cycling group around this. That's how he went on to get the support that he needed. So you never just know how the silly fundraising ideas or the conversations or this podcast will go on to be the key pinpointing criteria for someone being able to access support.
Absolutely. And it's amazing how many stars have aligned in multiple of your stories in this conversation already.
Lots of stars, lots of alignment.
Yeah. Well, next I'd like to ask, of course, this journey started going back to the beginning with the diagnosis of your son back in 2010. And then I understand that Rare Diseases South Africa officially registered in 2013. We're over 10 years since then. What are the main ways in which Rare Diseases South Africa, RDSA, has evolved over the years? And what initiatives have made the biggest impact on the rare disease community? Of course, you've mentioned the cycling event you do. What are the main ways in which the organization has evolved, and what have been its main initiatives?
I think 12 years later, and this journey has been fraught with numerous challenges and great success stories. But the one thing that always resonates with me, there's two things that keep me going. One is the opportunity to phone families, patients, and tell them that we've managed to get medication approved for them. There is nothing that can take away from that moment. I recently managed to speak to an adult who has spinal muscular atrophy, and he was the first approval we've managed to get for SMA in South Africa. I said to him, go have a glass of champagne. And he said to me, the first thing I want to do is phone my mom and tell her son stands a chance.
Wow. I can't imagine you can put any kind of metric on an achievement like that.
Right. And the other is when you see patients, kids in particular, who see someone that looks like them or has something that's similar, when you see their faces light up because they see someone that looks like them, those moments are what keep me going. I think from a development perspective and from an initiative perspective, marketing is probably one of the most significant things that you can do, is that raising awareness. And it's the way in which you do it. We had a choice. We could either go tell the sad stories, or we could tell them in a way that inspired some form of hope and focus on the lighter side of things. And that's what we chose to do. This stuff is terrible. It's tragic. We cannot save everyone. Patients often die brutal deaths. we wait, diagnostic journey is long. There's a lot of negative around it, but there's also a hell of a lot of positive. And we just choose to focus on that when it comes to the storytelling.
And I mean, it's clear that your organization has been key to saving lives, if not at least sort of boosting massively the quality of life through the actual guaranteeing of treatments for specific individuals. But it's also clear that the establishment of a community is something that allows individuals to no longer feel the alienation that they may have long felt being someone who lives with a rare disease, which is all too common an experience right across the rare disease community, no matter where you live in the world. Are there any initiatives right now that you maybe are keen to promote?
I think the one is our Patient Voices program. That's like our class moms. It's the only way I can describe it. Support groups are not always sexy. They just need to work. Support looks like a lot of different things. And I think when you try structure support too much, it fails. Support just needs to be fluid because it's different every day. So we started running a multitude of WhatsApp groups that are disease specific because it's a quick way for people to be able to send a call for help, ask for information, share their whatever frustrations they're having. And it's an easy way to be able to support people. And it's relatively cost effective. So we started those. And then we realized that actually what we need is people to volunteer to run those groups and to be like the person that filters information down from us as an organization into those groups and also filters information back up. And so we've started this membrane of support, which is called our Patient Voices Ambassadors. And we work on providing them with tools and resources and upskilling them and capacity building to be able to allow them to manage those groups. And what that does is it gives them the opportunity to make an impact in a place that they feel safe doing it without the administration of running a formalized entity. Because let's be honest, the admin is enough to send you over the edge at the best of times. So with us being able to do that and with us having done that, that project is now hugely successful. We have 196 groups that are running, disease-specific groups, and those patients get almost immediate support. And it's actually freed up a lot of capacity from our perspective as an organization because we don't have to be everything to everyone. Those groups become their everything, and we just then have to focus on the problems that are manifesting within those groups.
When it comes to rare diseases, there is quite a big marginal gain in the task of just providing the platforms that link people up. That's the sense I get. Honestly,
that is why you join any group. For 95% of our patients, there's no commercial therapy. All that is available to do for them is make sure that their pain is well managed, that they've got access to their immediate, social, economic needs, and that they feel supported and their mental health is supported. If you do that, if they're in pain, but they're happy and they're in pain and they feel supported, they already have much better outcomes. And support really doesn't cost much to give. It's having an ear. It's being able to offer advice. That's often what support looks like and what it feels like. And we've managed to find a way to run those groups that's relatively cost effective, but also gives us mass scale. It gives us feelers that we would not be able to have out there if it wasn't for the fact that that platform existed.
So I'd now actually like to ask you a question about the situation in South Africa. On behalf of South Africa's rare disease community, what exactly do you perceive as the biggest challenges and perhaps also opportunities to improving the lives of people living in South Africa with a rare disease?
We have a low middle income country. We have competing health priorities on a massive scale. 20% of our population are HIV positive. You're dealing with malaria, you're dealing with tuberculosis, you're dealing with water sanitation issues, etc. So there's very real primary healthcare needs that are a massive cost driver within our economy. And as a result, there's less piece of the pie for the rare disease patients to benefit from. Access remains a real challenge, and getting companies to invest in Africa when it comes to pricing also becomes a problem because it has an impact on their markets around the world. So they almost don't want to entertain coming into South Africa. That remains a big challenge. Opportunities, wow.
Yeah.
We are, as a nation and as a country, we have what is called Ubuntu. And that is, if you want to walk fast, go alone. If you want to walk far, go together. And that spirit combines us. So we are quite happy to move slowly, but to bring everyone along with us. And as a result of that, we've had really, really good opportunities come up, and being able to address basic things like health literacy, being able to speak to people in their own language, being able to address issues around cultural beliefs and stigma have massive impact. Always lots of opportunity available to us. And I mean, if only we had more time.
Now that's interesting, actually. And funnily enough, that you say that quote about if you want to go fast, go alone. If you want to go far, go together. That was actually something that one of our board members said in Brussels just last month when one of the EU institutions was actually announcing its support for greater solidarity with rare disease patients across Europe. Of course, rare diseases are individually rare, but collectively they are incredibly common. If it's not too much getting into some policy weeds, I think that in South Africa, there has been a new national health insurance system that's been in the process of establishing. Is that correct? And what is that meaning right now for the rare disease community in South Africa? Is that a challenge?
Yes, it's happened. And the promise of universal healthcare, I think, is something that we can all get behind, particularly as a rare disease community. It's something that means a lot to us, and it's definitely what we want. The issue that we find ourselves having is how it will be constructed in an environment that is set up for vast corruption, misappropriation, expenditure issues. There's certainly a big amounts of fear. Taking into account we have a very, very low tax base within South Africa. We have about 6 million taxpayers and 60 million people. So when you're relying on that to fund the entire healthcare system, you can understand that it brings a massive challenge. And if we can get it right, no doubt it'll have an improved impact on the thousands of state patients that are currently not accessing any care in this country. It's like the scales of justice. There's a plus side and a negative side to everything. We've just got to hope that our advocacy is strong enough that we don't get left behind in the process.
I see. I guess rare diseases would kind of take a further hit if more resources are distributed to those areas. Is that maybe a concern?
It is 100% a concern. You know, we get asked every day, why treat the one rare disease patient when you can treat 1,000 HIV patients for the same price? And, you know, my question back is, well, what do we say to the one patient that needs this? Are they not valuable enough? Does their life not matter because they didn't have some in common? Equity is always going to be a difficult discussion, and we have to keep moving forward. We can't go backwards. We have to be assured of the fact that when NHI is implemented, patients don't go backwards in terms of what they're able to access.
Yeah, no, absolutely. It's important that in rare disease healthcare, there aren't these steps backwards. So you'll be aware that actually Rare Disease Day is taking place on the 28th of February, 2025. By the time this podcast goes out, the Rare Disease Day campaign will have seen the launch of the 100-day countdown to February the 28th, 2025. What significance does this day hold for you? And what does equity mean for the South African rare disease community? What unmet needs are there that need to be overcome to achieve equity for them?
Firstly, Rare Disease Day, favorite day of the year, even though it's just after my birthday. And I feel like I haven't had a birthday since we started celebrating Rare Disease Day in South Africa because it's always such a busy time of the year. But it's so amazing to see everyone come together from across the globe. It's just an awesome collection of activity. In terms of equity, there's a lot of challenges. Equity and equitable access are two very different things. You know, for us as South Africa, our big thing is recognition. If we can just start by acknowledging that these patients are out there and recognizing and knowing enough to be able to identify them and make them feel seen, I think that that in itself will be a giant step towards equitable healthcare and those patients feeling as though they are included in the equity discussion. And I think that that's why Rare Disease Day is so important, because it's about driving a conversation that encourages the public for just one day to understand a problem that they might never be faced with, and for us to drive compassion and understanding. And then obviously after that comes the shift in policy. Equitable healthcare is based on people getting access to what they need, and that need is not a one-size-fits-all approach. And Rare Disease Day helps us to do that because it opens up the lines of communication.
And that's quite relevant to the fact that the theme of the Rare Disease Day campaign every year is indeed equity and not necessarily equality. Equity is supposed to reference the fact that there are distinct needs that need to be addressed per individual with a rare disease condition. It's no good generalizing them, and even worse, generalizing their needs. So it's really interesting to hear you make that point. So you've achieved incredibly impressive things, not just for your son, but for the rare disease community in South Africa. My final question to you will actually be, what advice would you give to new advocates or parents just beginning their journey after either receiving a diagnosis for a rare disease, or maybe after starting to witness themselves or their child have symptoms of a condition which may seem complex or rare?
The important thing is to start, because everything changes, healthcare changes, access, treatments, everything making changes. So don't let striving for perfection delay starting. And then from an emotional perspective, this is terrifying stuff. We have no idea what we're doing. I'm sitting here 13 years later. I still have no idea what I'm doing. And that's fine. But I choose to do it scared, because at least I'm doing something. Don't let fear hold you back, because that's debilitating. Every success story is a result of numerous failures, and that's the reality. So that would be my advice. Start, even if you're scared, then do it scared.
Well, on that note, Kelly, thank you so much for sharing your story with me today. And that's a quite powerful message to end our conversation on. Thank you so much for joining me today and sharing your story.
Thanks for having me.